Thank you for tuning in this evening to Conversations on Cannabis, What's New in Florida, Virtual Forum. This is a program of Florida A&M University's Medical Marijuana Education and Research Initiative, aka MMERI. As we're getting started, please take the survey in the chat. By taking the survey, you will be entered to win a grand prize to be announced in June. Did I mention it is grand? Trust me, you don't want to miss this opportunity. I am Angela Hardeman, Public Affairs Liaison with the program, and I'm thrilled to be your host this evening. The layout for tonight's program includes 30 minutes of direct questions to our panelists, followed by another 25 minutes allocated for specific questions from our viewers through the live chat and/or those that were submitted during the event registration. And speaking of the many questions and stories submitted in advance, thank you. We really appreciate it. Sadly, we won't be able to address them all this evening, but we will share them and engage with you via our social media channels. We, MMERI, are charged by the Florida Legislature and in partnership with the Department of Health's Office of Medical Marijuana Use, OMMU, which is the official source of responsible use, with educating Florida's diverse minority communities about marijuana for medical use and the impact of the unlawful use of marijuana. We're going to do just that by educating, learning, and talking about it tonight with two very special guests. Allow me to introduce them. Dr. Terrell Newton is an interventional pain consultant, anesthesiologist, and the executive director of acute pain relief with offices in Jacksonville and Orlando, Florida. He received his MD from the University of North Carolina in 2006 and finished his interventional pain management fellowship at the University of Vermont in 2011. Dr. Newton's passion for optimum patient care is evident in his dedication to community engagement, particularly those education and awareness events focused on non-opioid treatments, non-surgical treatments, and plant-based CBD, hemp, and medical cannabis. Thank you, sir, for being with us tonight. And
Thank you, Angela.
You're welcome. Thank you. Let me add that Dr. Newton has also conducted over 20 medical cannabis dispensary and cannabis farm tours in Florida since 2016. So that end, our panelists will have great synergy this evening, which brings me to Ms. Holly Bell. Ms. Holly Bell is the Director of Cannabis with the Florida Department of Agriculture. She's passionate and has had a passion for agriculture starting at a young age, growing up on a farm in Warsaw, Indiana. She had a weekend job counting money at her family's manufacturing business, which sparked her interest in finance. She graduated from Purdue University in 1985 with a bachelor's degree in agriculture, economics. And upon graduation, she worked around the world in finance, including work in Nashville as a banker and consultant to young entrepreneurs in the cannabis space. One of her main goals is to bring that entrepreneurial spirit to Florida. And Ms. Bell, we thank you so much for engaging with us tonight.
You're welcome. Thanks for asking me. I'm excited to be here.
Oh, we really appreciate it. So let's start off with the basics, because medical cannabis is still fairly a nascent industry, relatively young. Dr. Newton, what is medical cannabis and how does it work on the body?
So when we look at it, medical cannabis and it being available in different states, first we have to look at, how is it defined for Florida? And so for Florida, we have two main categories. We have a low THC cannabis and we have a medical marijuana. And basically what cannabis is, it's a plant-based extract that's used for medical purposes. And it's from the Cannabis sativa and Cannabis indica plants. There are other species. There's another one specifically Cannabis ruderalis that generally doesn't have a lot of THC or CBD in terms of its concentrate, so it's not really seen much medically. But the majority of the extracts that are used are Cannabis sativa and Cannabis indica, which are plant-based medicines that patients can take in Florida for qualifying conditions. There's a variety of routes of how the medicine can be taken, anywhere from the whole flower to capsules to tinctures, which are drops that go under the tongue, to topically, and now we have edibles now becoming available as of August 27th. So when you look at medical cannabis and define it, we define it based on each state's definition, because you might have go to another state and then they have other forms of cannabis that might be available or might not be available. For instance, if you look at Georgia, they may not have edibles available, and they may not have higher concentration of THC available. They have a limit. At one point they had a limit of 5% THC for their products. Here we don't have any specific limit. It's really more based off what the patient needs and the physician's recommendations.
Gotcha. And I'm just going to go ahead and go there. So how does medical cannabis differ from that's on the street? Let's just, while you're talking about
it. First of all, it's regulated and tested. Something on the street, you don't know what's in it. It could be cocaine, fentanyl, could be, maybe it's not even cannabis at all. It's not tested, not regulated like the medicine here in Florida. It's not, governed in any way. Here, the dispensaries are very strictly tested, that the products that's listed on a label is actually, what they have. There's random tests, and the tests are carried out several areas along the way. So from the time the seeds are planted, there's testing done. It's also tests that there's no contaminants, no fungal contaminants. The medicine is it's not exposed out in the open, where there's some environmental things like pesticides that can get into it. Like I mentioned, fungal infections, other types of pests that can transmit disease. Mm-hmm. So with medical cannabis, it's tested. We know what's in it. It's safe. One thing about cannabis is that there's no reported overdoses on cannabis. If you're getting something on the street, it may be something in there that could cause an overdose. We don't know if there's, opiates mixed in there, cocaine, anything could be in there.
Mm-hmm, mm-hmm. And while you're talking about that, sir, can you just expand a little bit on how it works on the body, how cannabis works on the body, particularly for those folks who might be considering it for medicinal purposes and have been reluctant? And we all know that there's a lot of stigma still surrounding cannabis.
Yeah, well, one thing to take note of is that we have a type of cannabis that's already naturally in our bodies, and that's called the endocannabinoid system. It's where one nerve cell communicates with another, and also where our immune cells communicate. The specific name of those molecules are anandamide and 2-acylglycerol on the histologic level. And so one of the reasons why cannabis works so well with nervous system conditions is because many people have deficiencies in their own endocannabinoid system, and where the plant-based cannabis supplements those deficiencies, it can have significant improvement in symptoms. The other thing of how cannabis works outside of the cannabinoids, there's a lot of anti-inflammatories. There's also muscle relaxants. There's a whole nother set of medicines that's called terpenes. And there's also other medicines besides that can give benefits nutritionally. So a patient can still get protein in that. They can still get other anti-inflammatories. Terpenes work by, the main mechanism they work is by reducing the inflammation. And so whether you have inflammation in the GI tract, such as with Crohn's disease, or if you have inflammation from rheumatoid arthritis or from a traumatic injury, as you see with chronic pain, cannabis has many different molecules, many different medicines in one that can significantly help patients with their system, with their pathology, that are a lot more well tolerated because it's a system that we already have in our body.
Great. And before we did have one question from one of our viewers. Thank you, Shane. Shane wanted to, while we were talking about the testing, does it mean that recreational cannabis might not be tested?
Recreational medicine, cannabis is not tested. It's off the street. There's no way of knowing what's in it when you take it. And in a lot of cases, it's actually laced with something else to make it more addictive, so someone will keep purchasing it. But
Mhm.
it's not tested. There's no regulation on it. There's no way to know what's in it unless it's sent to a lab. But again, it's not tested.
And so, Dr. Newton, should we go ahead and touch on the qualifying conditions to be recommended for
Yeah,
medical cannabis
yeah,
marijuana?
and actually, there's a couple of conditions I really wanted to actually focus on. And here recently we heard about the death of Chadwick Boseman that has been in the news and been a very unfortunate story. I know a lot of us have felt personally touched by it. But cancer is one of the main qualifying conditions. And of course, he died of colon cancer. I don't know if he was a cannabis patient, but I know he underwent a lot of treatments, surgeries, chemo, and radiation. And one of the reasons why cannabis is such a good medicine is that it can help someone tolerate their treatments of radiation and chemo. And sometimes it can help the medicine, the chemotherapy work even better. And again, I don't know if he was a cannabis patient or not. He was very private with regard, to what he was going through in his personal life. But cancer is a huge diagnosis, and it's available for all types of cancers, not specifically limited to colon cancer, but breast cancer, and lung cancer, really any type of cancer. And another important condition, given the pandemic and everything, is post-traumatic stress disorders and related conditions. So, for example, anxiety, which we've seen a huge increase, given the pandemic that's been, going on in 2020. And so we see a lot more patients that's either not responding to traditional treatments or not wanting to, go through those side effects of many of the antidepressants. One of those main ones being sexual dysfunction. In some cases, some medications have the side effect of making you more depressed. They can also have things like, dry mouth. They can affect your blood pressure. So many patients are seeking alternatives for those two very important qualifying conditions. And the other good thing about Florida is that anything related to PTSD, so anxiety, depression, anything similar to that also qualifies as a condition. We also tend to see a lot of patients with Crohn's disease and seizure disorders as well. But I would say because of the pandemic, we definitely have had a huge increase in PTSD and anxiety patients. And overall, since the pandemic, we initially saw about a 30% increase that was going from January into April and May. And maybe Ms. Bell could chime in on, the other trends that have been observed by the Florida Department of Health for the Office of Medical Marijuana Use as well.
Ms. Bell, did you want to take a stab at that?
Can you repeat that again?
Yeah, I was just mentioning some of the numbers and the increases in patients. For example, the dispensaries have seen, just going from, January, as we, have had the pandemic and into April and May, they've seen about a 30% increase. I know around that time, the numbers of patients total, have been around 350. They're probably closer, getting closer to 400,000 now. There has been also an increase in deliveries. The first about 4 to 6 months in the pandemic, there's about 2 to 3-fold increase in the deliveries, and I know that you all have done a wonderful job of expanding the contactless deliveries that patients are allowed to receive, and also making available the web-based renewals and follow-ups. So I was wondering if you could elaborate some on some of the different adaptations that we've made and some of the numbers and trends that we've seen with the pandemic for this year.
Actually, I'm going to go ahead because I know Ms. Bell speaks on behalf of the Department of Agriculture, and we should probably direct our viewers to the Office of Medical Marijuana Use, their website, where there's a ton of information on patient usage and things of that nature. That website is www.knowthefactsmmj.com. and there's a wealth of information there. But I don't know if you had anything to add, Holly, on behalf of the Department of Agriculture.
Yeah, I do. We do. It is Department of Agriculture and Consumer Services. So we do talk to a lot of consumers on a frequent basis, and I do get regular feedback. The trends that I have seen nationally, Dr. Newton has an excellent point. We're all stressed out right now.
Yes.
It is a hard time. We're learning to live differently. We're learning to interact differently. Thus, we're all here virtually tonight. The use of cannabis to help with that, with the anxiety and the stress, is up significantly nationwide. We oversee CBD stores, you might say, here in FDACS. And I know from talking to my retailers, their business, their consumption by consumers is up at least 30%, like you said. It is significant. Those stores were allowed to stay open during the pandemic to help people so they could have the CBD, which would help calm them down, hopefully. So I also know, and I do go out to the OMMU site and look at those numbers, and the number of cards are up significantly too. I myself am a card holder. I'm not allowed or not afraid to tell that. And I do know that there's been some nights that I can't sleep, and it's helped me be able to sleep and have a more restful, calm night when things seem so terribly uncertain. So I know it has helped me personally, and I know several patients that it's helped because I hear from them, and I do know the consumption trend is up nationwide during this time.
You know what? Thank you so much for being transparent. We as we traverse the state, there's still so much stigma surrounding this, and here it is, a professional that's involved who would disclose that, and I really, really appreciate that you being that honest about it. And let's just go ahead and talk about, since sales are up and folks are considering this for medicinal purposes, obtaining the card, Dr. Newton, what is the process that they must go through?
Yes. Yeah. In consideration of, I'll list the qualifying conditions. And the other thing to keep in mind is that medical conditions that are similar to any of these conditions can also qualify a patient, or a terminal condition. So we have cancer, epilepsy, glaucoma, HIV/AIDS, PTSD, ALS, which is Lou Gehrig's disease, Crohn's, Parkinson's, and multiple sclerosis. So the way a patient is, evaluated is done by a physician. And once the physician determines that the patient has a qualifying condition and a patient may benefit from medical cannabis, specifically that the potential benefits outweigh the risks, then the patient can be added to the Office of Medical Marijuana Use Registry. The patient will receive an email once that registered account is created by the physician's office, and that will allow them to go ahead and get their card. So there's some additional information. They have to upload their ID and pay the fee for the card. And once they have the card, the physician will already have put in a recommendation, and then they can take their card to a registered dispensary, and then they can go and pick up their medication. So the Office of Medical Marijuana Use has a list of all the dispensaries that are certified to dispense medications. When a patient gets their recommendation, they may have a recommendation for low THC cannabis. They may have a recommendation for medical marijuana. They may have a recommendation for both. And the provider will also put the routes of administration that's allowed and the dose of medications.
Okay. Wonderful, wonderful, wonderful. Okay. All right. So let's jump into some more current things, hence the title of tonight's program, about things that are new. So the centuries-old plant, marijuana, has been in the news for the last few years, and most recently there's been a big development and advancement with edibles. My oven, I got some brownies, and I'm just kidding. I'm not, unlike Holly, I am not qualified or recommended. I haven't been recommended. But last week, the Department of Health's Office of Medical Marijuana Use authorized the state's 22 licensed cannabis producers to produce and sell THC-infused products such as cookies, candy, and brownies. And Ms. Bell, what can you tell us about, it was an emergency designation, this rule. It took effect immediately. How does this impact the cannabis and hemp industry from the Department of Agriculture's standpoint?
So the one area that we do overlap with the Office of Medical Marijuana Use and Department of Health is the edibles piece. We co-manage that with them because you're baking food for consumption and it's in a kitchen, and that's what our food safety team, our division inspects for the whole state. So we, along with DOH, wrote rules for the edibles piece of the medical marijuana program of Florida. We've had those rules adopted and in place since March of this year, which at that time, any of the 22 licensees were allowed to come to us and ask us to inspect their kitchen and give them a certificate of whether they passed or not. And we had 4 of them that in April and May came to us, and we had an inspection done, and they were ready to go as soon as the emergency rules hit last week. So we're all ready to go with that. We're very excited. The commissioner is actually, this is something that she has been pushing for quite some time. And Dr. Newton would probably agree with this. It's for some patients, this is the best form of delivery. And especially those that are really sick, they need it. So we're very excited that this is now here for our patients. And that's the most important thing to think about. And I did talk to some of the licensees in the last few days and the people that run those, and they're anticipating that with approvals and testing, within about 8 weeks, they should have product on shelf. So I'm very excited about that.
Wow. Wow. Dr. Newton, do you have a follow-up on that as it relates to implications of this option for patients?
Yes. I will mention that, again, looking at each state, so edibles for Florida includes lozenges, gelatins, baked goods, chocolates, and drink powders. And so that could be either low THC or the medical marijuana.
Mm-hmm.
And these are products that are labeled very specifically by the Florida, there's strict standards for that. And the other thing to look at is the dosage. So if you come across a product, it doesn't have the strict labeling, doesn't have a dosage on it, that's not from a qualified dispensary. So that's what it will look like when you pick up your medication. The wonderful thing about edibles is that the patients tend to absorb more cannabinoids in an edible. It's almost like taking the food with a small meal. And you have many patients dealing with severe nausea, Crohn's patients, cancer patients, patients receiving radiation and chemo that don't take much by mouth. This is a way to absorb a greater amount of medicine in a more palatable formulation.
Mm-hmm. Mm-hmm. And I'm going to take a point of privilege to go ahead and just to remind our viewers and those that might be listening in that our charge is to educate Floridians and diverse minority communities about marijuana for medical use and the impact of the unlawful use of marijuana. MMERI does not advocate one way or the other. We bring in the experts to talk about it. And so I think it's very important for us to remind folks when they're tuning in that we are not advocating for the usage either way, but we have to. It's a prevalent subject, it's a pervasive topic, and it's very real. So we have to put the information out there. That has been our charge from the Department of Health to do this. And so, Dr. Newton, if you will stay right there and talk about what should, and I actually want you both to weigh in on what should and should not be done with that medical marijuana card. Like, you can't loan it to a friend like you loan your debit card and give them your PIN number.
No. No, this is a medicine. You know, this is specifically recommended for an individual. This is, you know, not something that is an open door to share medicine. Is, you know, you have to secure your medication. You can't let someone just get access to it. This is not something that, you know, you want a child to be able to access because they can get very sick. You know, these doses are specifically recommended for each patient individually. You know, and you know what you want to make sure to do is you want to stay within the rules and regulations and guidelines of what we have for Florida. There are some states that have something called adult use, and adult use is different from medical use. So we're just recommending medication for an individual patient. And so we have to adhere to those rules and regulations very strictly. You know, there could be, you know, significant legal consequences if someone, you know, shares their medication, they sell it. So, you know, it's very important to adhere to the physician's recommendations that this recommendation is for you. We understand you might meet someone who also wants to try it. I would say encourage them to go get a physician evaluation to see if, you know, cannabis might be good for them, might help them in their particular situation. But it's not something to be shared. It's very serious. That medicine is your medicine. It's up to you to secure it. It's up to you to make sure that you're following the guidelines set by the Office of Medical Marijuana Use. And just take, you know, just approach it with that seriousness because it is something serious. If someone took your medicine, they could have a drug interaction. I mean, interactions are very rare with cannabis, but they are possible. Specifically with, for example, blood thinners. If somebody takes too much CBD, it can affect their blood thinner. They could have a problem with bleeding. And so you always want to, you know, adhere to, you know, the standards of what's in the guidelines for Florida. Now, if you go to another state and they have different regulations, they have recreational use, you don't necessarily need a physician's recommendation, then it's fine in that state. But so long as you're in Florida, you have to go by the Florida guidelines.
Absolutely. Ms. Bell, what do you want the viewers to know, or what does the Department of Agriculture want the viewers to know about legal and illegal use of cannabis?
Well, I have to reinforce what Dr. Newton is talking about. This is a prescription for you as an individual given to you by your doctor. You wouldn't go out and share your high blood pressure medicine. You wouldn't go out and share your cholesterol medicine. Don't share this. It is for you. And if we're going to keep a good and compliant program, we need to follow the rules. That's important as consumers. You know, the other thing I did want to mention, while we're in this phase where we're restricting where we go and all of that, we have been allowed to use telehealth to renew and see our cannabis doctor for our medical card. So for those who have compromised immune systems, you don't want to necessarily get out, that you don't have to go do a live appointment. You can keep yourself safe and germ-free if you want in doing a telehealth appointment. So that the Department of Health has been really good about thinking about those that may not want to get exposed to germs. So that's great advantage for patients right now also.
You know, I was really impressed with the flexibility, and essentially cannabis was deemed an essential service when the safer home orders were implemented. And that was wonderful because you would have to see a physician first, face to face, right?
Mm-hmm. Yes.
Recommended. So yeah, I applaud that as well. Well, now that we've gotten the basics out of the way and provided an update on the newest development in Florida, let's go to some of the viewers' questions. I am getting these fed to me by our team. Okay. Corrine has a question. Are you, and this goes back to the whole testing, the testing discussion, are you not speaking of the unregulated market when you allude to untested cannabis?
I'm more than happy to jump in on that. I do believe when Dr. Newton was talking about that too, in any state where you have any kind of legalized cannabis, whether it's adult use or medical use, there is testing requirements. So the thing you want to understand is if you are not buying it in a regulated system by the state, It is not tested. And he is right. Anything could be in that product. Anything.
Let's stay right there, Ms. Bell, and you can answer this one as well. This is from Marcus. Who, meaning entities and organizations, is regulating the qualified dispensaries, and who is assuring testing the quality and efficiency of the available medical marijuana and CBD products?
So on the medical side in the state of Florida, the Department of Health, OMMU, regulates that testing. And in June, they put out emergency rules that were adopted on testing of all dispensary products. And they licensed 3 testing labs that had to qualify and submit an application to be a qualified medical marijuana testing lab in the state of Florida. So those have been in place since June. On the over-the-counter side with the hemp program, the Department of Agriculture does regulate that with the food safety team. And we go out and randomly pull samples from the marketplace and test the products to make sure they are compliant with labeling laws, that they have in them what is said on the label, that they are also tested for all kinds of contaminants, a huge panel of them. And we have recently put out press releases where we have found products that weren't safe for human consumption. And we as a department go out and put a stop sale on those and have them pulled from the shelves so consumers can no longer consume them.
Okay.
Yeah, I'd like to just elaborate just a little bit on that as far as the testing. So, and this is public information as well from the Office of Medical Marijuana Use. Microbial testing, so that's things like fungus is probably the most common infection that you would see of a plant. But also bacterial infections, residual solvents, heavy metals, agricultural agents. So pesticides are not used on the medicine here in Florida. Moisture and water testing, cannabinoid testing, and validation testing. That's confirmation of what we deliver in the medication. So the doses. So this has THC. This is a medical marijuana product. This product is a low THC product, so it doesn't have above 0.8% of THC. It has at least 10% CBD.
Gotcha. Dr. Newton, this question is from Tiffany. What does research say about the use of CBD during pregnancy versus the use of THC?
Well, the thing, that's, one thing to say about pregnancy is that if a substance is known to be harmful in any way, we don't do any studies in pregnant patients. There's not been any research to show that it is harmful, but there is some theoretical assumptions that's made. And one of those assumptions is that because we have our own endocannabinoid system and the development of that is important, when we're developing our organ systems, our nervous system, our immune system, and that period is called the period of organogenesis, when organs and our systems are developing. And because we have our own endocannabinoid system, there's a theory that if you influence that system, it may somehow affect development. And so the theories are that it could potentially cause some longer term, dysfunctions and developmental delays that persist onto adulthood. And so it's not thought to be as severe as something, like a Down syndrome or a spinal bifida. But there are things that happen in terms of behavioral and cognitive, delays. And again, this is theory. There's no specific, studies that have looked at this in humans because it's not ethical to study it in pregnant patients. But if you look at, countries where cannabis has been consumed during pregnancy, there's not known to be, a significant, immune deficiency or specific, damage to the brain. However, during pregnancy, you want to consume as minimal of medicines as possible. That's just because we don't know exactly, what the outcome would be. And so looking at CBD and THC, either cannabinoid will influence the body's own developing endocannabinoid system. And so, the recommendation is to avoid high dose of any or either cannabinoid in that instance.
Awesome, awesome. You all have been so wonderful. You wouldn't believe we have folks that are joining us halfway through the program, and I just want to shout you out and say thank you for being here. While we're in the middle of the program, we are recording this, so it will be posted on our website and on YouTube and otherwise. So thank you for being here, and we hope you enjoy the remainder of the program. Send us your questions because I'm getting them steadily. This viewer actually has a story and a follow-up question. It says, I have epilepsy. It was suggested by my doctor that taking CBD because the medications weren't working. Is it better to consider the THC or the CBD for seizures?
Okay. Well, again, you have to go specifically by your physician's recommendation, but I will mention a few observations that have also been confirmed by research studies, is that in general, CBD is a stronger anti-seizure medication than THC, and actually the first medication we just here recently came on the market. It's a CBD extract called Epidiolex. But THC is good because it often helps in a synergistic way. So in other words, taking a higher dose of CBD with just a little bit, even trace amounts of THC, can often very significantly help reduce seizure activity. And again, you have to go, you have to talk specifically to your physician because there could have been other things that have been tried. Epilepsy is sometimes difficult to, give recommendations on because epilepsy is usually a consequence of something else. And so, is that epilepsy due to a seizure? Is that epilepsy due to a rare genetic disorder? The two most common genetic disorders are Lennox-Gastaut syndrome and Dravet syndrome, or is it due to a traumatic brain injury? So with epilepsy, you really have to look at the underlying cause, and your recommendation has to be done individually. For patients that's dealing with epilepsy and chronic pain, you might have a physician recommend gabapentin, which is an anti-seizure medicine that also helps with pain, and then, addition of cannabis, which helps with epilepsy and with pain. So they might work synergistically in some way together for that particular patient. So, recommendations have to be done individually, but historically CBD has been a stronger anti-epileptic medication compared to the THC alone. But CBD in high doses with a little bit of THC tends to work very well together.
See, and this just underscores why we have to do this. Going back to why is the university talking about medical cannabis / marijuana, because there are so many questions. Here's a question from someone from Gibsonton, Florida. What does healthcare look like in 5 years regarding medicinal and recreational use of cannabis? And Ms. Bell, I think you can touch on this as well as Dr. Newton.
I'm glad to go ahead and talk about that. I prefer the term adult use.
Yes.
I think that we're all adults. If it's something you choose to use an adult, then that's why I prefer that word. But as a nation, we are heading towards federal legalization, in my opinion. The polls indicate that 70% plus of our population would like to see it federally legalized. I know it would certainly make life a lot easier as a regulator if it was, and I think it would make it a little easier on the medical profession also. So I see us moving towards a system where we have more uniform regulation, we have better education, which is so vital, and I'm so glad you guys are doing this, and a more consistent message that's clear for the end user. That's where I see us in 5 years.
Dr. Newton?
Yes, I'll speak on both aspects. And that's one thing I think to really be excited about as far as the medical, aspect and in the future And I see that trending as well in terms of greater access being available to patients all around the country, not just in any particular state, and also expansion of the qualifying conditions to where, like where I trained at in Vermont, we had medical cannabis available for any condition that the physician or provider deemed medically necessary. So I see that trend continuing to expand. It is a wonderful time to be here in Florida with the addition of edibles becoming available. And we do have a lot of supporters for adult use. I don't particularly speak on adult use, but the trends are there, and they're pretty much undeniable nationwide. We see more and more people looking for an alternative, not just alternative for alcohol, but just alternatives for recreational drugs. Many people look at cannabis and compare it to other drugs. Now keep in mind, every person can have a tendency to be addicted to even sugar. But cannabis compared to other substances is much, much less addictive. And so addiction is a problem of the personality, it's a problem of the dopamine center of the brain. So you can't say, okay, because this person takes cannabis, they're at risk for addiction. What puts you at risk for addiction is really, your individual physiology, your environment. But cannabis compared to other substances is, much more safer. There's no specific amount that can overdose a patient. So I think with, looking at adult use and comparing it to, let's say, alcohol in terms of, what many consider the most widely abused drug or substance taken into the body, it's much safer. You don't see things like liver failure. You don't, see things like, we had mentioned in pregnancy, there's a fetal alcohol syndrome. There's not a similar syndrome with regard to cannabis during pregnancy. And so, there's so many aspects where cannabis is much safer compared to other substances.
And Angela, I would like to add another thing, and Dr. Newton, please chime in. But as we move towards adult use and federal legalization, it pulls it off our Controlled Substance Act, and we can actually have more research done, which more research will give us more facts. More facts can help us educate the population better. And that is needed here. We stopped that research years ago. Other countries have continued that research. And that is so vitally important that we get that back in place here in the United States.
Absolutely. And not for this program, but definitely at some point in the near future, maybe we can talk about the MORE Act and we'll see what happens with that. The MORE Act. I know that Vice President candidate Kamala Harris is actually the lead sponsor for that right now. So maybe that'll gain some legs one way or another. So not to get too political, but then talking about the addiction thing now, I will say no more than, again, MMERI does not advocate either way for marijuana. And talking about addiction, if you call the cake shop, I have them on speed dial. My sugar addiction is real. So let's just, full disclosure. So because we're talking about that's my vice right there. Chris had a question, Ms. Bell, about the number of how many farms have signed up for the hemp program in Florida. They're taking advantage of you being right here. So wanted to pass that question along to you.
So we have 550 cultivation permits that we've issued, and I have had about 5 successful harvests already. We started issuing those licenses on April 27th, and we're starting to have production slowly come through the system. So that's really good. We're really excited about this and what's going to come in the next year. And the license is free this year, so anybody that's thinking about it, it's a good year to apply and not have to pay a permit fee.
Okay. Awesome.
I would like to mention this. Our program here in Florida is tremendous compared to one of our neighboring states. We have to pay a $100,000 application fee. I'm not going to mention any names, but I would say I really appreciate what everybody's done here in Florida for hemp. I think we will be the #1 hemp state in a few years. It's a wonderful program. I would encourage everyone to, just do more research and learn more about the different types of hemp, especially, looking into industrial hemp. There's so many uses. It's amazing.
We're talking about economic development now. I read somewhere just recently where in the next 10 years, 1 in 10 jobs will be in cannabis and hemp. That's huge. That's.
Well, Dr. Newton had a great point. If we all look around in our room that we're sitting in, there isn't much in the room that can't be made from industrial hemp. And it would help our economy, it would help our environment, and it's just a great thing. And I do look forward to that day when we can look back on that and say, yeah, this is really good.
Mm-hmm. Mm-hmm. Wonderful.
I would like to mention, I appreciate you mentioning, just kind of defining things. I just want to kind of remind everybody that hemp is the cannabis plant where the THC content is no more than 0.3%. So that takes it out of the Schedule I category of controlled substances. And this is why hemp is in a different regulatory category compared to medical marijuana.
Mm-hmm. Thank you for that. That's very useful information. Look at this, y'all. There's somebody asking a question from Chicago, Illinois.
Wow.
I know, right? What is the growth rate of medical cannabis card holders in Florida? And I'll just go ahead and answer that. And encourage them again to visit the OMMU, that's the Office of Medical Marijuana Use website, which is www.knowthefactsmmj.com, where there's a wealth of information provided there. All right, good deal, good deal. This has been fantastic. Any closing remarks? I do have some important mentions, but any closing remarks from you, Ms. Bell?
No, I appreciate you guys having me tonight. You're a great group, and I so appreciate what you do. And Dr. Newton, I so appreciate what you do. Thank you to all of you. It is so vital, and education is so key. So anything I can ever do to help, the Department of Agriculture is here. We do have a website at cannabis@fdacs.gov. You're welcome to reach out to us anytime. We promise to get back to you within a day and help you out however we can. So hope you all have a good night. Thanks.
Thank you.
All right. Well, I'm Dr. Newton. Do you have any closing remarks?
Yeah, I do. And, I hope you guys don't mind me doing this. I will like to just say anyone out there, I know, me personally and members of my family, especially the younger members of my family, have been personally affected by this recent loss that we had with Chadwick Boseman. And, he was, I think, even more so a hero in real life than he was on the screen. If you follow his life and look what he dealt with the last 4 years, it's just amazing and tremendous. And I just want to encourage you that if you're dealing with this, this anxiety, this depression, feeling like you lost someone close to you, number one, talk to someone about it. And if you feel, that you need more intensive treatment, you visit your physician, ask your physician, what should I do as the next step? I have these feelings, should I get counseling? Go ahead and set an appointment with your physician to kind of discuss it, because, we don't want any type of anxiety, pain, and suffering to go unrecognized. And I will say, I am with you. If you feel that loss, I'm with you in feeling that void myself. And when you connect with someone who is so dedicated to what he does and he resonates with you, because he was us. He was one of us. He was like family. And when you feel that loss, I just want to encourage you to express that, to share that with someone else who might be feeling the same thing. They may be feeling that void. So I just want to encourage you to accept those feelings, realize that they are real, and take it to the next step and talk with someone about that.
And, I'm going to go ahead and just echo similar sentiments to you, Dr. Newton, because every time we call you, you answer. You've been a regular on our programming and we really appreciate it. Obviously, you're more than abundantly qualified to be here. You're very modest, but I'm going to go ahead and encourage you to do a shameless plug and let folks know how they can reach you as well.
Yes, the best way to reach us, and we also post our current events, like this wonderful event that we do. This is this our third or fourth webinar, and we have more to come. I'm really looking forward to, updating everyone during Breast Cancer Awareness Month on just some of the progress that has been made in the research. But you can visit our website at tprfla.com. And if you need to come in for an appointment to our Jacksonville office, you can call 904-374-0353. And again, I thank you all. I thank both of you for, putting together such a wonderful event, and appreciate all the listeners that have been listening in. And I encourage you to continue to learn, expand your knowledge in cannabis so you can become a cannabis expert.
Absolutely. Yes. Thank you, viewers. We really, really appreciate you. We know we didn't get to all of your questions, but every time we do one of these forums, it just really at least makes me feel good about, what I do professionally in getting the word out. Me and the team, a very, very hardworking team. And we doing it statewide and now virtual. Our engagement is virtual. If you will indulge us for just a few more moments with some important mentions. Again, thank you for everyone who registered for tonight's event. As we shared, you were entered into a drawing for a $100 gift card. Now, let me be clear, this prize is courtesy of our partner, iHeartMedia. The winner will be chosen, actually has been chosen, and we will email you in the next 24 hours to claim your prize. Engage with us, attend our virtual forums. Go ahead and mark your calendar for the next virtual forum, which will take place on Monday, September 28th at 7 p.m. Subject matter to be determined. We'll let you all know that very, very soon. We are available to speak to your organizations and your groups. And of course, we want you to stay informed. Our website is MMERI, that's mmeri.famu.edu, and be sure to check out our link to the repository. You can call our office. We are still answering the phone at 850-561-2456. And of course, you can find us on Facebook, Instagram, Twitter, and YouTube. Lastly, tell us how we did tonight. Take our post-event survey, and that link should be in the chat as well. And in closing, I just want to thank our panelists again. You all are fantastic. Thank you, viewers, for tuning in tonight, and especially the state of Florida, the legislature, and the Department of Health's Office of Medical Marijuana Use for allowing MMERI, for allowing us to lead this charge of educating, learning, and talking to minority communities about marijuana for medical use and the impact of the unlawful use of marijuana. We look forward to engaging you again on September 28th. Have a great evening.